I'd like to introduce Carlos Robles. He's the head of endoscopy at the Ecuadorian Institute of Digestive Disease. He is an interventional endoscopist that does a myriad of procedures, significantly published many articles, and very innovative. Carlos?
So, good afternoon. Thank you so much for this kind invitation. For me, it's a really pleasure to be here. I want to ask first, Dano, how many of you are physicians here in the room? One? Okay, so it's good. Fantastic. So, the second question is, anybody have fear about bleeding or blood or something like that? Well, it's okay. So, it's fantastic. So, I would try to talk a little bit about not just my experience. I believe the talk of Dr. Vega and the other colleagues will be amazing because I believe they will show it what I already have as an experience, as Dr. Vega said. But I want to make a presentation in another perspective, in the perspective from the physician and from investors and in the size of the company, right? So I will talk about the bipolar and microwave technology that is Creo Medical Chroma technology that you have, the present and the future, right? Because as investor, yes, you want to put money there in the company and say, yes, I want to invest because the revenues are good, but how big could be these revenues in the future? And that is important also to understand a little bit. So next slide, please. I have this. So a little bit talking not too much about the background, but we need to understand why bipolar energy. And I believe already many of the persons that make the presentation showing a little bit why bipolar is important. It's important because we can avoid a lot of complication during minimal invasive endosurgery, you can say, or endoscopy procedures. And this is very important, you know, because you have better precision, less collateral tissue damage, and improved safety compared to monopolar energy, right? So as was mentioned also, the bipolar electrosurgery use two electrodes. You always will need two electrodes located in the same instrument. It means the energy is in the tip of the device and not other way. So that's make it safer. And this provide high localized heating, reduced thermal spread, less risk of stray energy injuries, better control in confined space like GI tract, ENT, laparoscopic surgery, and also robotics. I will explain a little bit what is microwave. It's the same that you have in the cell phones. How many cell phones are here? I have cell phones. You have well, the same microwave, right? Is using to make coagulation, but also to destroy tumors, which is amazing, right? But I am really grateful for this invitation because I learned a lot. I had to read a lot of the engineering part because I want to understand what I am saying when I came to here to give you a lecture. So the application in medicine are a new field of growing interest with a significant trend in healthcare research and development. The first application of microwave was in 1980s, was for tumor ablation, and we continue in this, platform for the treatment of cancer, and their application have been expanded. And as a microwave energy is a form of non-ionizing radiation. This is very important. This is something that we probably don't understand too much, but everybody knows X-ray, right? X-ray, CT scan, right? Radiation. Radiation is not good. It's good, has been the technology that we needed to use it during the last 100 years, but it doesn't mean that it's perfect. So we need to move to new technologies like this one. So it doesn't make any alteration of the molecular structure of biological tissue and has a significant biomedical application. So this is something that you already saw it, right? You have an advanced energy platform, you have an advanced energy instruments, and we need more of these. And we have endoscopic instruments with Creo Medical right now. So I will show a little bit the evolution of this speedboat that you investors investing on this. But this is how when Dave visited me, and I think 5 years ago, 6 years ago, something like that, I saw 15 engineers, amazing engineers, in my unit, and we were working and we were talking about all this technology. And this helped us to start to come from the speedboat 3.2 millimeters to the ultra slim, and you can see how the energies distribution is much better. And the evolution now, I really like this notch speedboat, and the design, just this change, a small change in the design, could be like easier, but no, we need to think a little bit more on this, because the energy concentrate more here, and this special area that is the notch area increase the microwave coagulation, so it makes it easier for me. So right now I'm very happy, to be honest, with this. I will show you what we are doing right now with the technology. This is Dr. Daniela Tabachela. She's in Romania right now. She was my fellow 2 years ago. And Creo bring to me these scissors, and I start to use it. I really like it, the concept, and we start to see some new applications. As Dr. Vega showed you, this is a polyp in the duodenal part. So monopolar sometimes is very risky in this area. So Daniela was the first time using this, to be honest. She never used it before, and she did it right away without any training, and it was during a live course with 7,500 physicians looking in 87 countries. So it was good, because they sometimes have fear about myself, because he bring me something and I say, look, I want to go live, and he say, no, it's not good, because I say, look, I believe it's good and we will do okay. So this was one of the crazy things that probably I made it, but I am showing you the way that Dr. Vega was showing her resections. You see no bleedings. Very nice case. No perforation, no risk of perforation after that. And you can see how it cuts very well. And no risk of, later perforation because of monopolar. And this was made in 12 minutes. You see? So it's just that. Okay, I will continue. So we need to understand a little bit also about microwave technologies in medicine. As I mentioned, it's a non-ionizing spectrum that goes from 300 megahertz to 300 gigahertz. So this could be applied as a thermal and non-thermal biological interaction. I would like to talk a little bit about the thermal biological interaction with the microwave technology. This was the first case that we made in a patient with a renal failure with this pancreatic tumor, neuroendocrine pancreatic tumor, unresectable because of her renal failure and all her conditions, but also because of the size of the lesion. And we applied this technology to burn, to destroy the lesion. This is the result. So you can see how it's black is because of the tissue of the cancer, right? And then once it becomes white, for me, it's okay. It means I destroy everything. And I confirm 2 months after, the patient is still alive. She will die for sure one day, as everybody, right? But I believe not for the cancer right now, okay? So, which is very good. I would like to talk a little bit about the future. It means what we'll have as a new advanced energy endoscopy instrument, what we need, and what we can create in terms of microwave technology in medicine, non-thermal biological interaction, and AI, and also bipolar technology and AI, because I believe it's part of the future, and these have a big potential because, as you already mentioned, you are unique, to be honest. You are, because you are investors also of this. So in terms of immediately, for me it was a surprise to arrive here and to see exactly what I needed, with the exception of this. But all these new ideas or things that we need in our job is necessary, but now is possible because you already do it, which is fantastic. But we were discussing a little bit about new things that we need, and I believe it's easier to do it in the next months or next year, probably. But the thing of AI enhanced bipolar energy is very important because, and it's very interesting because of the clinical advantage. You have more precise optimal energy doses, safer, lower risk of injuries, and more reproducible standardized procedures, right? So one of the big advantage how AI will enhance bipolar energy is that we will have a real-time tissue characterization. It means AI will classify tissue type by analyzing sensor data on your device that you have. It could apply intelligent energy modulation. It means the tissues are not the same from a small kid, my age, and older age, or it depends on fibrotic or other kind of situation that you had in your life. But AI will adjust this energy to have more specific tissue subtype and avoid. If we have almost zero complication that Dr. Vega showed, I believe we will arrive to zero, and that is amazing. So we can have a predictive safety monitoring. AI detects early signs of excessive heat, for example, and make an auto-regulation as your cell phone. When the cell phone start to heat, it's quickly, stop everything, and then we'll be fine. And this integration with imaging and robotics will be fantastic for the future, and I believe it's not so far of that. So the other thing that I believe is very interesting in terms of microwave is about the principle of dielectric properties, contrast, sensing using microwave. What it means is it's too much, right? I didn't understood until I read it before to coming here. So the thing is, the microwave, we have microwave right now working here because we have all the cell phones on. So these sensors, yes, pass through the tissues, and we can predict just by analytics. It means AI. So if this tissue is normal or is abnormal, it means there is something happening there, like inflammation or infection, and even tumor. So that will be a game changer in terms of the future for this. It means we can, with these dielectric properties, contrast as a biomarker, and will help us a lot in diagnosis. Dr. Vega was saying about diagnosis is a little bit tricky in terms of growing up, cancer at early stage, and microwave can help us with that, with this. So we have several technologies now that are under investigation, but the future is very interesting of using microwave accelerated metal enhanced fluorescence. It means with nanoparticles, nanotechnology, we put some metals, and we can increase the fluorescence of the cells that we have, and we can increase diagnosis of this, not just for immediately diagnosis, but we can have ultra-fast detection in second, very low detection limits, and ideal for point care of diagnostic virus, bacteria, microRNAs, proteins, oncologic biomarkers, and intraoperative detection. It means if a surgeon goes inside, imagine to have this technology with microwave to see much better, not just with the eyes, looking at the cellular level. So it will be very interesting. And this is all the possible application of this technology in the diagnostic area. It means blood pressure stimulation, dielectric characterization that I already talked in, the liquid detective characterization, because a tumor, our bodies is composed of water, but a tumor doesn't have the same quality and quantity of water. So this will help us just to predict where is the lesion, because sometimes the small bowel on the body, move. So we can measure the blood levels of glucose, for example, for monitoring this by wireless, not to pick, the diabetics have to pick and then to put the blood there, and it's a lot. One needle for me is the nightmare, right? So and we can see other things and also destroy tumors and continue to improve this. So the applications in modern medicine, I believe, will be non-ionizing technology, enabling to safer diagnostic and therapy with AI-enhanced clinical decision-making and reconstruction speed and workflow efficiency, and application span imaging, molecular diagnostic, ablation, pathology, telemetry, and waste sterilization that I believe is something that is very interesting for the future. So AI-enhanced imaging diagnostic, we will have leveraged the electric contrast for non-invasive radiation-free diagnostics. That I believe will be part of the future, and also the revenues of the company. Deep learning accelerates reconstruction and increased diagnostic precision, molecular diagnostic, and the electric spectroscopy for high accuracy levels. In terms of therapeutic application and emerging technologies, we already have that, and we talk about these ablations, tumors. We have a lot of data worldwide right now, but I believe this is very interesting in terms of drug delivery accelerating using microwave, activate nanoparticles. It means we can treat with pills, with drugs. We will say an antibiotic, and we can amplify this antibiotic to treat. So we can diminish the doses. Even we can treat the infections just by microwave, which I believe will change. This is a game changer for the future. And also sensors and telemetry enabling continuous remote monitoring will be easier. Imagine that you go home, and I don't know, daddy or mommy or some family person at home, you know, moreover in older population like Europe, for example, there is increasing and increasing. So these people doesn't have this kind of change. But if you have remote telemetry, sending information to the physicians, so you can even prevent a stroke or you know, treat the patients quickly and in an easier way. So you are here. This is where you are. So microwave ablation in treatment in endoscopy is fantastic, and for robotic and for surgery and for pulmonology and all of these areas. But you have just one part of 10 possible development. It means more revenues, more other areas that will be very interesting for the future. And this is my last slide. What should we understand from this? So for me, microwave technology are shifting from niche tools, like you have right now, to mainstream medical platforms. This need to see as a platform, not just as a therapy, right? That could increase healthcare technology to treat patients and diseases, but also increase sales and revenues for you. Second, AI integration transform data-rich microwave and bipolar system into precision diagnostic and therapeutic device. This is the mediate feature. Clinical impact, faster diagnosis, minimal invasive treatment, and improved patient outcomes. From the investor perspective, I believe a scalable hardware, AI software stack, multi-market expansion, especially in oncology, pathology, imaging, telehealth, sterilization, including surgical, robots, and devices, and high growth potential driven by unmet needs in non-invasive diagnostic and target therapy. So thank you so much for your attention, and sorry for the video, it doesn't work, but it was amazing. Thank you so much.